Hey everyone, and welcome. If you're a pharmacist, you know that some patient conversations happen way more than any others. Today, we're going to dive into the single biggest reason for consultations in your practice, and we're going to arm you with the solid evidence you need to handle it with total confidence.
Just think about your last shift for a second. That question you get asked over and over and over again, especially when cold and flu season hits. What is that one symptom that drives more people to your counter than pretty much anything else?
You guessed it, acute cough. It's wild, but this is responsible for more than half of all new patient visits in primary care. And for us, well, it's a constant in the pharmacy. It seems so simple, but this is actually where we run into one of the biggest challenges in our entire practice.
And this right here, this is the core of the problem. A patient walks in, they're miserable, and they expect a quick fix, a magic bullet from the shelf that's just going to make the cough stop. But the clinical reality, what the science actually tells us, is that for most of those over-the-counter products, there's a huge, profound lack of evidence. And bridging that gap? Well, that's our job.
So, before we can even think about counseling, we have to respect the symptom itself. Let's just take a quick step back and ground ourselves in the basic physiology. What exactly is a cough?
It's so important to remember that a cough isn't the enemy here. It's a protective reflex. It's the body's built-in, totally natural way of clearing junk out of the airway, whether that's mucus, dust, or whatever. So our goal isn't always to just silence it completely, but to manage it in a smart way. Now, clinically, we break cough down by how long it lasts. You've got your subacute and your chronic coughs, and they definitely need a proper workup. But for us today, we're zeroing in on the most common visitor to the pharmacy by far, the acute cough. That's the one lasting less than 3 weeks, usually from a simple cold.
Okay, so that patient is standing at your counter. They're coughing. Where do we even start? Well, I'll tell you this. The answer is not on the shelf. The first and honestly the most important steps are all about giving good advice and setting some realistic expectations. Our goals here are pretty strategic. Ideally, we'd treat the underlying cause, right? But with a common virus, that's just not an option. So our focus pivots to two really critical areas. One, making the patient feel more comfortable, and two, preventing any complications down the line. Before you even think about reaching for a product, just remember our most powerful tools are often the simplest ones. Now, the hard evidence for these is, let's say, a little light, but simple advice like staying hydrated, using a clean humidifier, and steering clear of smoke can make a real difference. And hey, for that annoying postnasal drip, nasal saline can be a great first suggestion. This is fundamental care. Okay, now for the main event. Let's walk over to that aisle that causes so much confusion, the cough and cold section. This is where we, as the evidence-based experts, have to be able to separate the slick marketing from the actual medicine. And honestly, you might be surprised by what we find. Let's start with the big one, cough suppressants. Dextromethorphan, or DM. It's in so many products. And the promise is simple, right? It'll stop your cough. But here's the real question. For a cough that's coming from a common cold, does it actually work?
Well, the evidence is pretty stark. Multiple systematic reviews show little to no benefit for these coughs. In fact, some studies show they're no better than a placebo, a sugar pill. And get this, the American College of Chest Physicians flat out does not recommend them for this. That's a huge deal.
All right, so if suppressing the cough isn't really an option, what about making it more productive? That's the whole claim behind expectorants, like guaifenesin, that they thin out all that mucus and help you clear it. But what does the science actually say about that? You're probably sensing a theme here. The evidence just isn't there. Studies have shown that even at high doses, guaifenesin doesn't really thin sputum or increase the amount you cough up. You know what the most effective expectorant we can recommend is? The one we already talked about. Just drinking plenty of fluids. Simple hydration. So this raises a really important question, right? Why do so many patients swear by these things? Well, a huge part of the answer is the placebo effect, which is incredibly powerful when it comes to acute cough. The simple act of taking something, the taste of the syrup, it can make people feel better. Understanding this is absolutely key to counseling a patient who insists a product worked for them last time.
So after all that myth-busting, you're probably thinking, okay, great, so what can I actually recommend? Well, it turns out one of the most effective, evidence-backed remedies isn't a manufactured drug at all. Let's meet our unexpected hero.
And that's a direct quote from a Cochrane review, which, as you know, is one of the highest standards of evidence we have in medicine. Honey, it's been shown to be more effective than no treatment and even better than some common medicines at relieving cough symptoms, especially at night. This isn't just some old wives' tale. This is real, solid evidence.
Now, putting this into practice means we have to counsel on it correctly. There are 3 critical steps. First, and this is non-negotiable, you must confirm the patient is over 1 year old because of the risk of infant botulism. Then, you can recommend an age-appropriate dose, usually before bedtime. It's simple, it's safe for most people, and it actually works.
Okay, now we need to talk about our most important role, protecting our youngest patients. The stakes here are incredibly high, and the evidence-based guidance is something we all need to know by heart.
The first number every single pharmacist needs to have burned into their brain is this one, 6. It is a critical cutoff. And here's why. Health Canada has put out a crystal clear advisory. Because there's no good evidence these products help, and there is a risk of rare but serious side effects, we're talking things like seizures, these products should not be used in children under 6. Period. It's an absolute contraindication.
And there's a second critical number we need to talk about, 18.
This is just as important. Health Canada also advises that no one under the age of 18 should be given any cough product that has codeine or any other opioid in it. Our job is to be that final safety check, to intercept these potential sales and guide parents to safer, evidence-based alternatives. And so, that's where we'll end. The patient standing in front of you isn't just a customer. They're placing their trust in your professional judgment. They see the flashy marketing on the box, but they listen to you. Armed with this evidence, you can move beyond just selling a product and start truly providing care, reassuring them, offering effective advice, and guiding them to the very few things that are actually backed by science. And that's the real value of a pharmacist.